Spanning the planet. You've landed at the pet entertainment center of the universe. Alert the paparazzi. This is Pet Life Radio, the ultimate animal adventure.
And welcome to all of you on this glorious Sunday morning out here in the West. Sunday, just getting into that afternoon hour, just a minute or so after noon in the East. I'm your host for the next half hour. I am Dr. Jeff Werber, host of Ask the Vets with Dr. Jeff, and we're here for you. Here to answer your questions, help you with your pets. Any information that you either couldn't get, didn't understand from your veterinarian, you can just call in, send me a text, send me a note here live at Pet Life Radio. You can give us a call, 877-385-8882. Once again, 877-385-8882. You can also log in, PetLifeRadio.com, go to Ask the Vets tab, and you will join in the conversation. There's a huge box there. Just type away. Lastly, you can always send a quick email to drjeff, that's Dr. Jeff, at PetLifeRadio.com. And we'll go ahead and help you out. And as an extra bonus, other than free information, just for calling, sending me a text, joining us on the show, don't be bashful. We will send you out a free Prosense product and a free Kong product. So you can't lose. You can only win. And anything that we can do to help you and your pets is great. I just heard, I was just telling Mark, our producer, that I'm going to be on next Sunday again on Fox and Friends. I do a number of Fox and Friends episodes. So I'll be heading to New York myself. And I understand it's getting kind of cold there, huh? So anyway, any of you there in the East, at least come on and tell me how I should pack. So, but I'll be there doing a segment on holiday hazards next Sunday on Fox and Friends. So that should be fun. Anyway, we have been on a fairly detailed path over the last several weeks, and we are talking about some of the very common endocrine-related diseases that we see in our pets. We've spoken about the disease called Cushing's disease. We talked about Addison's disease. And we are going to then, we started briefly talking about hypothyroidism, which we're going to really delve into today. Then we're going to go into some of the diabetes conditions, the diabetes mellitus and the diabetes insipidus. Not related. One is a pancreatic problem, and that's the diabetes mellitus. That's the sugar diabetes. And the other one is more of a brain-water balance, sodium-potassium type of condition. There's a hormone called vasopressin, which tells us and it helps us respond, and our pets respond to signals from the rest of the body, how much we should be drinking, and of what we drink, how much do the kidneys save, and how much do they get to excrete. And that disease is also a disease that we have to deal with, just not to mix the two up. Anyway, so on our discussion of the thyroid disorders, and by the way, if any of you have had animals that have had thyroid problems, we definitely want to hear from you. There are so many different things and so many nuances and different ways to treat these conditions now that we'd really like to hear from you. Let us know whether it was successful or not, how your pets did on the treatment, how your pets did after the treatment, etc. So don't be shy. Give us a call at 877-385-8882. Share your stories with us, because it's interesting how much our other pet lovers can learn from the experiences that others have had. Sometimes you don't always want to learn this stuff firsthand. You want to have that preparedness, and by hearing others, and if faced with a dilemma as far as treatment, and maybe one or two different methods or three different ways to go when it comes to treatment, hearing other people's stories might help you decide what might be the best way to go. Because as is sometimes the case, I don't want to say often the case, but it's sometimes the case, we hear that, I'm going to just take this phone away, as is sometimes the case, that if you put in 5 veterinarians into a room, there's a good chance you'll get 6 different opinions. So we always have to make sure that medicine is not exact. I wish it were, and as I often joke, I said we read the books, we learn. You may read the books, you may know, but unfortunately, our pets haven't read the book, so they don't know how they're supposed to respond. They don't know how they're supposed to react, and they don't know how they're supposed to act even with a disease. So that's what makes what we do so difficult, because our patients can't tell us. We, the veterinarian, is relying on you to give us the information and the right information, and sometimes it's difficult for you as well. So, thyroid. Interestingly, there are it's a gland. It's usually right by the neck. Unlike people, the 2 glands are not attached. That is very important when it comes to potential treatment. In people, there is what's called an isthmus. It's like a little, almost like a piece of land attaching the 2 thyroids. So frequently when a person has to deal with a thyroid problem or have a thyroid removed, they have to take both lobes of the thyroid, where it's really, in humans, it's more like a single gland that with 2 lobes, where in animals, our dogs and cats, they're 2 separate. So the condition that we often see, let's talk dogs first, is hypothyroidism. And sadly, hypothyroidism is often overdiagnosed. And it's not when I say overdiagnosed, it's often diagnosed. A dog is diagnosed with having a hypothyroid condition, when in fact they don't. I'll explain why. So it's very important that you need to be a bit more proactive, especially. And this is not a stab at anyone, because I was there in the same place years ago, but there are a number of tests that need to be run before the diagnosis is made. And the typical test that is run as part of a blood screen is called the T4. And the problem is that level, that T4 value, can be very affected by other problems the dog may be having. Meaning, it will often appear to be low. A doctor might make a diagnosis, therefore, of hypothyroidism, low thyroid, when in fact it's not low at all. And we call this sick thyroid syndrome. So it's a puzzle, because you have a dog that presents ill. Dogs that often present ill are ADR, ain't doing right. They are a little sluggish. They may not be eating well. So, that could be low thyroid, because the thyroid hormone is what sort of keeps us active. It adjusts our metabolism. It gets our heart pumping. So dogs that are truly hypothyroid, low thyroid levels, are, they're often gaining weight. They are really sluggish. They're moping around. They are more prone to illness. For example, since the link between our metabolism and our immune system. Our immune system doesn't function as well in a hypothyroid state. So these dogs, whereas a normal bacterium may not cause a problem in a healthy pet, in a dog with hypothyroidism, it may. So that's the classic appearance, the classic presentation, if you will, of what a truly hypothyroid dog is like. Well, if you have a dog that's sick and let's say has a severe intestinal problem, well, God, they're mopey. They may not want to eat. They're sitting around. Their skin might look ugly and dry, and all these things. And then you get your test back, and it says, "Oh my God, the T4 is low. That must be hypothyroid. Let's start treating." And that's a huge mistake. A huge mistake. So, what needs to be done is to separate out the different type of thyroid hormone to really know for sure whether or not a dog is truly hypothyroid, low thyroid function. Now, I use the T4 as a screening test. I use that along with clinical presentation, history, age, breed, all those things we call signalment, and to determine whether or not your dog is truly hypothyroid. And if we have a T4 that comes back low, and we want to really rule in or out true hypothyroid versus, say, sick thyroid syndrome, then there are some other tests that need to be run. One is called a free T4 by ED. ED stands for equilibrium dialysis. And if free T4 by ED is also low, then very likely that is confirmation that the dog, your pet, is truly hypothyroid and could be needs to be treated accordingly. Now, another test is just like with, as you've hopefully, if you've been paying attention when we talked about Cushing's and Addison's and all these diseases and prednisone, the body has an amazing feedback type of system where it could read what is low and what is not low, how things are doing, and then signal the appropriate gland to either act or not act. And one of the things that we have with the thyroid is the same thing. The pituitary gland in the brain can stimulate the thyroid via a transmitter called TSH. It's a thyroid stimulating hormone. So when TSH is released by the brain, it signals the thyroids to start pumping out hormone. So when the body is truly low on thyroid, not sick thyroid syndrome, but low on the thyroid hormones, you can imagine, if you figure this out, is TSH going to be secreted from the brain more or less? Well, it's going to be more, because the brain picks up, oh my God, we're low thyroid. We got to signal that thyroid gland to get its butt in gear and start cooking. We need more thyroid hormone out there. So it sends that signal via TSH. So if you run a TSH level on a dog that is low thyroid and TSH is normal, what does that tell you? It tells you that the dog's not really low thyroid, because if it were, the body would have been throwing out more TSH from the brain, and we would have elevated TSH, which then brings me to the second way to really truly evaluate whether or not the low thyroid T4 in the blood is real via TSH. So when TSH is high, meaning it's picking up the fact that the dog truly is low thyroid, the brain says, hey, we got to do something about this. Quick, get into gear. Let's spit out some TSH. Let's stimulate that thyroid gland. And the thyroid gland is not listening because the dog has a true thyroid disorder. Then that's another way to confirm the hunch, the diagnosis, that yes, in fact, the dog is truly hypothyroid. Now, having said all this, and now hopefully you all get a much better understanding. But I even in this day and age, and I'm talking, this is, when I say new, it's not new. It's relatively new. It's for the last 15 years, we've really learned more about the thyroid gland. And when I started practicing many moons ago, we looked at T3, T4. If they were low, we started supplementing with thyroid hormone. Now we're finding out we were way over diagnosing true hypothyroid. As a matter of fact, we don't see it as commonly as once. But just it's so interesting. I had a case that was referred to me, and the dog was on the thyroid supplement, which we'll get to in a second, and on a post-treatment test about 2 months later, the thyroid levels were high. So what does that tell you? It told me that I better look at this dog's records to see what test was used to diagnose the quote-unquote hypothyroidism in the first place. And sure enough, all this doctor used was a T4. Here we are in 2014 with all this amazing information. And this doctor made a diagnosis, and even worse than that, the low normal, depending on what laboratory, for normal thyroid is either 0.9 or 1, whatever. And this dog was 0.8. It wasn't even that low. And he didn't do another test, didn't do a TSH, didn't do a T4 by ED to truly confirm whether this was true hyperthyroidism. So what happened? Of course, you start giving this dog thyroid hormone as a supplement every day, twice a day, and his levels are going to go up. You're making the dog hyperthyroid. So that's why you really need to know that don't let, and you can challenge, veterinarians, we're okay with being challenged. Ask questions. especially if the veterinarian's older. There's nothing wrong with it. Look, I'm older, so it doesn't make a difference. But you have to, if there's any question, there's so much more that we learn. And, it's one of the reasons I joke that I hire young associates, because I don't have to go to CE, continuing education. I get it all from my young associates. So, but it's very important to make that distinction. Treatment, I just alluded to, actually fairly simple. Once it's determined that the dog truly is hypothyroid, treatment is pretty easy. It is a thyroid supplement. Personally, there are generics out there, and though I'm a firm believer that generics are fine, are antibiotics. I don't have to buy name brand of certain antibiotics if it's available now as a generic, and some of these generic companies are great. When it comes to replacement hormones, it's my own take. Obviously, check with your veterinarian. It's fine. But I kind of like using some of the name brands. There's a really good name brand. There are two. One is called Thyrotabs. One is called Siloxane. No, I'm not getting paid by any of them. I'm just saying that I don't like to buy levothyroxine tabs, purely generic. The Siloxane has been the industry standard. Thyrotabs now have also hit the market and are very trustworthy. But I personally stay away when it comes to hormone replacements, because how important they are, using some generic company that's just spitting out medication from wherever. So anyway, that's our basics. You're all thyroid, at least hypothyroid experts now. And given that, we are going to take our quick break, be back in a few minutes, and we're going to talk about the opposite of hypothyroidism, which is hyperthyroidism, which, unless the doctor is giving your dog too much thyroid medication, we don't usually see in dogs, but we see it a lot in cats. We'll be right back.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
And welcome back. You're here with Dr. Jeff Werber. That's me. I'm Ask the Vets with Dr. Jeff here on Pet Life Radio, the only live call-in radio show. Call in, Skype in, write in, whatever in. Just do it. So we can talk pets. Before the break, we were discussing, as part of our series on the hormone diseases, what we call the endocrine diseases affecting our pets. We're talking about hypothyroidism, that's low thyroid hormone disorder, which we see in dogs. And again, to recap, the typical symptom is that dog that's got kind of mopey, putting on weight, lack of energy. Skin is sometimes very dull, sometimes greasy. We see this a lot. If I see a dog like this, a golden retriever like this, I'm thinking primary hypothyroidism. But we caution about making a diagnosis too quickly because of the fact that other conditions will drop our T4, the thyroid hormone, the standard thyroid hormone that's often included in most of the blood tests, and we can have what's called a false decrease of thyroid. Doctor goes ahead, starts supplementing without confirming, and that can lead to some problems, actually creating a hyperthyroid state. Now, hyperthyroidism, that is an over-secretion of the gland. And there, it's the opposite, of course. We see it in cats, and it often is seen in cats, older cats. And, what's so weird about it is, we're talking, this could be diagnosed in a cat that's 16 or 17 and perfect. And the only challenge is, and by the way, one of my older cats, 16 actually, did, I could say nicely, happily, have hyperthyroidism. He's a Maine Coon, Norwegian Forest Cat cross. He's huge, 22 pounds and not fat. So I'm noticing him. He's getting older. He's 16. Everything's fine. Eating up a storm, happy, all good. But I noticed when I pick him up and I brush him, he's losing a little weight. So I bring him in, and he was down to 14 pounds. That's 8 pounds. But he's so big and fluffy, it's really hard to tell. So it was due anyway for his annual physical. So I'm taking bloods, and now what I do, and I recommend this, and I've spoken to many a veterinarian, telling them to do this as part of the routine. That when I do a blood test, an annual senior blood test on a cat over 7, I always automatically include that T4 by ED. That is the free T4 by ED, equilibrium dialysis. We talked about it in the last first 15 minutes as far as dogs, and to really differentiate between true hypo or hyperthyroidism and the actual T4 level itself that can be affected by many other things. And sure enough, his with a high normal free T4 by ED from 10 to 50, good old Oreo was over 100. And greater than 100 means that they stop counting once you hit over 100. So I had my diagnosis. I'm thinking, oh, that's it, of course. So interestingly, and happily for Oreo and of course me, his kidneys at 16 are still doing amazingly well. And the reason why I mention that specifically is that because cats, as they get older, probably with each advancing year, especially when they hit the late teens, they will probably 100% or pretty close to that succumb to kidney failure. So when you have a cat that is also concurrently hyperthyroid, you have to think about this for a second. But when you have a hyperthyroid cat who also has kidney disease, believe it or not, the kidney disease doesn't look as bad. And here's why. What do the kidneys do? The kidneys are filters, if you will. And they're filtering all these bad things out from the blood. And blood is pumping. Well, if you can imagine that since dogs that are hypothyroid, everything is moving more slowly, the heart is slowing down. What happens to a cat that's hyperthyroid? Their blood is pumping faster. They're going through the system more. So every pass, if you have a filter, for example, any kind of filter, a coffee filter, and you run it through twice, right? So it's going to keep a lot of that bad stuff out better than had you just done it once. You get that second pass. Well, so here you have these kidneys in a cat, an older cat, that aren't working quite up to par. And yet you are passing the blood through more than once per cycle because the heart's racing much faster because of the hyperthyroidism. So what you would normally use to determine kidney function, the value is called BUN, creatinine. We'll get to that at a way later time. We talk about the kidney. But all of a sudden, it doesn't look so bad. But what happens? You finally successfully treat the thyroid problem. The heart normalizes, slows down. You don't get that extra pass through the weakening kidney. And all of a sudden, you can imagine your kidney values shoot up. So it's difficult, to tell a client, oh my God, we got these minor second disease, which we know in older cats becomes the major disease, and we see it abruptly when we fix the thyroid gland and fix the hyperthyroidism. So, but it's still when push comes to shove, you really have to treat the hyperthyroidism because these cats, I mean, they can get so thin, ultimately pretty weak, and then as they get sicker because of the untreated hyperthyroidism, all right, and where they've been pretty active and eating well but still losing weight, then they start slowing down because they're feeling lousy, and then they're still eating, but now they start putting on weight, so you think, oh my God, well maybe it's not hyperthyroidism. So it's very important, and I just advise, and there's nothing wrong with saying to your veterinarian, oh, you're treating my old cat, you're doing some blood tests on my old cat. Can you make sure that we really do both thyroid tests? I want to check for hyperthyroidism as well. So that's very important to include that in the basic testing. So and as far as treatment with hyperthyroidism, years ago in fact, I remember my first case of hyperthyroidism. Another value that is often high, we talked about the masking the kidneys, but we often see elevated liver enzymes with hyperthyroidism in cats. And of course, as we discussed, the heart's racing like crazy. You can have a heart rate over 240. I mean, it's insane how fast their hearts start pumping. So remember when I first started working for my ex-boss, I had a cat, 17-year-old cat, that he had diagnosed, he had seen and wanted to diagnose or treat the heart disease and the liver disease, and gave this client, obviously with a 17-year-old cat with heart disease and concurrent liver disease, a very poor prognosis. And here I come along, the young veterinarian, and knowing a little bit more about some thyroid issues. First of all, we did a test to evaluate thyroid. And because I could feel the gland, and because I know there's a tenet in medicine, and this is for humans, don't look for 4 different diseases going on at once. I'm sure you guys watch House MD, right? What you're looking for is the one disease that can cause all of these symptoms. Well, I'm thinking old cat, I could feel little knobs in the neck, fast heart rate, liver disease. I don't think it's 2 different diseases. I don't think cat's got heart disease and liver disease. I think it's got thyroid. We tested, sure enough, hyperthyroid. Well, this was 30 years ago. We didn't have some of the treatments and the treatment of choice then, and it was all about surgery. And we have to end up our show. We're going to finish this discussion next week or the week after, depending on whether I can join you live, because I will be in New York. I may be on a plane at noon Eastern time after doing my show. But the only choice of treatment was surgery. And here I am, young guy, right out of school, taking the thyroid glands out of a 17-year-old cat, full anesthesia, clearly. Well, P.S., this cat made it to 19 and a half, and it was just an amazing case. But fortunately, surgery now is not quite passé. It's still done, but we have many other options, and one, the way they treat humans. And I'm going to leave you in suspense until next week, or hopefully next week, maybe the week after. If you get a chance, Fox and Friends next week. If anyone of you are in New York and you want to come down to the studio, Fox Studios on 6th Avenue in the high 40s. We usually shoot our segments outside. It might be cool to walk by and visit us. And that's Fox and Friends next Sunday. Otherwise, I'll be with you next Sunday or maybe in 2 weeks. I want to once again thank our sponsors, Prosense Pet Products, the veterinary quality pet products available at the over-the-counter at the mass stores like Walmart, and also Kong Toys. So have a great week. I'll be back either next week or the week after. But again, if you happen to be in New York and you're listening and you want to come down Sunday morning and watch Fox and Friends live, then come on down. Introduce yourselves. Have a pleasant week. We'll be back. I'm Dr. Jeff Werber. Thanks for joining me.